Hello there. My name's Dickon Hayne. I'm a urologist from Perth in Western Australia, and I'm here talking to Jack Taylor. I know Jack for a few reasons. He's a student doctor at the University of Western Australia, and also he was also involved in the BCG mitomycin trial. So, Jack, how you doing? Thanks very much for chatting to us like this today. It's great. So you're in a pretty unique situation. You're studying to be a doctor, but then you had a diagnosis of bladder cancer. How was that? That's a tough first question, maybe.
Yeah, it was quite a strange experience, and it was something that happened very early on in my med school career. So I think I was only 4 weeks in, and ironically, it was during our kind of 1 week cancer block, so very on topic. Um, so I guess I don't really have anything to compare it to because it's all I've really known through med school, but it's been interesting to have a different perspective as I go through, see both from the patient side of things as well as training to be a doctor and see where the interplay is between the two sides.
Yeah, for sure. It's something lots of. I mean, it's you say it's in your first week you were doing like learning about cancers, and it's a sort of classic thing where all junior doctors, when they're training, they're sort of diagnosed. But obviously that's quite confronting. Um, So then maybe even more confronting when you get diagnosed with bladder cancer, and then someone talks to you about a clinical trial. Did you know anything about clinical trials before that?
Not really. I've obviously heard about clinical trials, everyone knows about them, but I've never really seen myself getting involved in one. And I think certainly when I was referred, I was a little bit apprehensive because sometimes there can be these ideas of clinical trials or a last resort when you don't have any options. I'd never really imagined being enrolled in a clinical trial as a first treatment.
Sure, sure. And so obviously you've been through the trial now, and when you reflect on it, what do you think do you think that it made the situation worse, better? Was it a lot of hassle? What did you think about it?
I think I had a really good experience in the clinical trial, to be honest. I think when you're a patient in a trial, you get a lot more care and attention from staff. And as part of the protocol, you've got a lot of extra follow-up and checkups that makes you feel like you're being looked after. Um, Compared to the alternative treatment, really, I felt like it was probably about the same amount of time that I would have had to be going to hospital, having treatments, if anything, with potentially less side effects for
Yeah.
this way.
Yeah. So Jack was a participant in the BCG plus mitomycin trial, which has been recently presented in Chicago at the Association's Clinical Oncology meeting there. The BCG mitomycin trial essentially has shown that BCG plus mitomycin has similar safety and efficacy to the previous standard treatment, which was BCG alone. Um, but it also patients completed more treatment, and we used less BCG. This is really important because there's actually a global shortage of BCG at the moment. So we're extremely grateful to people like Jack for taking part in clinical trials. Otherwise, we wouldn't be able to do this sort of work. Um, so do you think this has affected your career in terms of what you might want to do?
I think it's possible. I mean, it's hard to say because I feel like I'm still so early in my career. But when you go through something like this as a medical student, you do, as yourself, you're kind of anxious, you have some fear about the future, uncertainty, but at the same time, you kind of put that aside and you say, oh, this is actually all quite cool. This BCG treatment using a tuberculosis vaccine to treat cancer. I think from that side, it's been quite interesting as a medical student. And
What about how you view evidence in healthcare? Because you literally have almost a unique sort of experience for that.
hmm,
Um, d- it, I mean, I'm not saying that you have to go and be a clinical trialist.
yeah,
I think it would affect if you could do what you'd like. But will it affect how you look at data, do you think?
I think certainly looking at clinical trials, I would have a different appreciation of them. I think once you've been involved in it and see how it runs, it gives you a very different appreciation of where the evidence comes from and how it's made, and probably in a way that you wouldn't really be able to see otherwise unless you were a PI or running the trial yourself. So it's been unique to see it that way as a patient.
Okay. what were the downsides of being in a clinical trial? Did you experience any downsides, or what if you was there something that was uncomfortable or difficult, or
I think as soon as I got on the trial, it was no, there were no issues with the trial. I found it ran quite well. Initially, I found it was quite stressful to make a decision with treatment. It's always nice when someone tells you, this is your diagnosis,
yeah?
this is the treatment, and you can just go down the track.
And that's kind of tough for the clinician as well. What you're really saying is that we don't really know which one's best. And also, obviously, when you have a clinical trial, ideally you have this equipoise where one, there's one thing might be better than the other, but you obviously don't think it's going to be harmful to take part in the trial.
Yeah.
I suppose one thing about this particular trial was that we actually did have a shortage of BCG at the time. So actually participating in the trial did help to access drugs. So there can be some sort of tangible advantages in some circumstances. But yeah, it is sometimes difficult to talk about them.
Yeah.
Especially if it's yeah, there's going to be difficult for us too sometimes. I'm not going to complain about that. Is there anything else that you want to say about all that, or?
I just say, I think we're so lucky here that we've got amazing clinical trials being run in Australia, because it gives patients access to treatments and better outcomes in the future. And if we don't have these trials being run locally, then it's really hard for people to get involved in them. So for me, coming in for 9 weeks and then 9 months, if I had to go interstate or overseas, it just wouldn't have been feasible for me to do that. So having this local access to research, I think, is really important.
Yeah. Well, Jack, I want to thank you in two ways. I want to thank you. You've chosen to do medicine and to try and help people being a doctor, and good on you. But you've also, in that situation, you've also chosen to take part in a clinical trial. And of course, the other benefit from that is that will actually help people for a long time. So yeah, very, very grateful to you for participating.
Yeah, and thanks so much for running the trial and for having me here today.
Well, it's been great. Thanks, Jack.